3 years ago, we met a young kid named Carly, born with a congenital kidney condition. Carly had already spent nearly a year in total of her young life trapped inside the hospital by the time we met her. While our care team was hard at work to get her as healthy as she could be, she had grown tired of her daily routine. Her days consisted of a few meals, check-ins with doctors, and painful procedures that she didn't really understand, and 8 hours of TV and some games within a 140 square foot hospital room. While her health came first, her mood suffered. Pediatric hospitalizations are stressful and anxiety-provoking, and all she really wanted to do was escape this environment just for a bit and be a kid again. As medical students and volunteers, we've spent thousands of collective hours in the hospital and witnessed firsthand just how difficult hospitalizations can be for kids, and how much these children long to interact with the outside world. Hospitals know this too. There are entire divisions, called child life divisions, dedicated to improving the pediatric experience. Behavioral psychologists work with the kids on ways that they can find bits of control and autonomy within their hospitalized lives. While these teams provide essential services, the tools they currently use aren't able to give the kids what they really want: the ability to escape hospital walls and the autonomy to just be kids exploring the world again. At WeGo, we are able to combat isolation and anxiety in hospitalized kids by using telepresence technology to bring the outside world to the patient's hospital room. Through telepresence robotics, we allow these kids to explore children's venues, like the National Aquarium, providing them with the ability to explore and communicate with others as if they were actually there. Each child has their own tour guide, who makes sure they see everything that they want to see and facilitates conversations with other venue guests. Through our novel intervention, we provide child life specialists with an exciting new way to support the well-being of their patients and improve patient mood and satisfaction. Additionally, patient experience and satisfaction metrics are of great interest to healthcare systems, as they are increasingly being used in reimbursement models for how hospitals get paid by insurance companies. Having conducted over 500 tours to date, we've collected data demonstrating that our intervention leads to a statistically significant improvement in patient mood. Qualitatively, the impact is just as validated. Watching sick and injured children virtually leave the hospital, explore new spaces of their own volition, and immerse themselves in a world devoid of scary procedures and uncertain outcomes is a powerful and humbling experience. Today, our network consists of 13 hospitals, including Hopkins, NYU, and the University of Iowa, 4 venues, including the National Aquarium and International Spy Museum, and we are actively expanding. We've raised significant funding and were invited to give a keynote presentation to the Pediatric Academic Society's national conference prior to an unfortunate COVID cancellation. Given the flexibility of our tech solution, we've also been able to be active during the entire pandemic, from guided science experiments to robotic Easter egg hunts, and even interviews with a NASA astronaut. Having done largely pro bono work to date, our next steps include implementation of a subscription-based model that will allow our group to sustain and succeed in the long term, as well as seeking out new opportunities with communities facing limitations that could benefit from what we provide, such as elderly populations living in assisted living facilities. Excitingly, we have recently set up our first paying pilot program. We have the opportunity to reimagine the way we care for our most vulnerable, and we need your help to do it. If you know of any venues or hospital systems that you think would be a good fit, we would love an introduction. Beyond that, we are looking to raise $100,000 to support the development of our fleet, network, and staff so that we can reach 15 to 20 new hospital systems and advance towards our final goal: connecting any hospitalized kid in the country to places that make them feel like they're a kid. Thank you.